Good morning, everybody. My name is Dan Brady. I'm one of the battalion chiefs here at Nature Coast EMS. Hope you're having a good morning, and I hope you're all doing well and not going too crazy out there with all this COVID-19 stuff going on. I'm happy to be here this morning and to give you the Nature Coast EMS COVID-19 update. Happy to report once again that none of our team members, none of our staff have tested positive for COVID-19. We're really trying to work hard to minimize that, to keep that number down as much as possible. So that happens only with good teamwork and with hard work and everybody just really working together to make sure things stay clean, make sure they're washing their hands, make sure they're cleaning our boots, our uniforms, our units, our stretchers, everything. So everyone's working really hard to make sure that happens. So just remember, if you feel sick or if you're diagnosed with COVID-19, stay home, stay isolated as much as possible. Wear masks. Utilize a bathroom separate from everyone else in your house for 14 days or so till you're symptom-free. Check in with the health department. They will give you all the guidance and everything, and check in with your healthcare provider. They're going to be guiding you and all that sort of stuff. So please, please, please isolate yourself if you have symptoms or if you've tested positive. We have had some cases where we've had multiple people from a single home or a couple homes. So just be careful, protect yourselves, protect your families, okay? Folks, remember that if you call 911 and you have COVID-19 symptoms, our crews are going to look different. We're telling them to have one person go to the door, even in cases who are not COVID-19 over dispatch. We're trying to make sure they go to the door to make sure you don't have those symptoms. And if you do, and we didn't know about it in the dispatch, they're going back to the ambulance to get all their full gear on. Later on this week, Thursday and Friday, we are slated to have some bad weather. Now, we all know how weather goes in Florida. It might be then, it might be a little bit later, but we're going to have wind and rain, kind of like we did last week. So just be careful. Be careful if you're out on the roads. Be careful if you do have to go out. Obviously, we're still reminding everybody to minimize how much you go out. A lot of folks ask us what it's like out here, what it's like to respond to COVID-19 calls, what it's like to work in a global pandemic. We're seeing a lot of different stuff. And I don't think it's quite how any of us expected, but we're seeing a lot of domestic issues. We're seeing a lot of drug usage. We're seeing a lot of single vehicle car accidents, people losing control, sometimes being affected by drugs or alcohol, sometimes not. But we just want to remind everybody to be kind to yourselves and be kind to each other. It's really a stressful time for our country right now, and we just want everyone to be as safe as possible. We have also seen many, many cases who have all the symptoms of COVID-19. We've seen cases of people who have a myriad of other medical issues because their other medical issues aren't stopping because of the global pandemic. We have people with heart problems, with lung problems, with cancer. All those patients still need medical care. So we're doing the best we can, and all the other healthcare providers in the county are doing fantastic work to take care of these patients still. So COVID-19 calls, my estimate right now is we're probably seeing roughly 4 to 12 in a 12-hour period. Potential calls, patients who have those symptoms, and we're getting in full PPE and alerting the hospitals that they may have these symptoms. Remember, only about 10% of people who are tested, 10 to 12% of people who are tested in the state actually come back positive. We're taking every precaution that if we have one of those patients, we're just acting like they have it until proven otherwise. So we're trying to be as careful as we possibly can. I want to say thank you to McDonald's. They just recently announced that countrywide they're doing meals for first responders and healthcare workers. So most McDonald's in the country are doing this, and it's really, really cool. Really appreciate it. Very, very kind gesture. And so just thank you so much to McDonald's. So many of you know we have a paramedic class, an EMT class here at Nature Coast EMS that's been interrupted because of the pandemic. I'm happy to report that we've just restarted our paramedic class virtually. So we're working on getting that going and getting those folks back up to speed and that class moving along so we can have more future paramedics out there in the world to take care of more people. We've recently promoted 2 of our staff members to battalion chief positions. Paramedic Shane Coleman and paramedic Vinny Dallaire have promoted to battalion chief. They've been training for a little bit with us. Starting this coming week, they're going to be out functioning in those roles, and they're going to have some oversight and supervision still right along with them. It's a lot to learn. It's a lot of hard work, and they've been really, really taking the role seriously and taking it up and working really, really hard. So if you see those guys, Vinny and Shane, congratulate them. Welcome them. They're doing a lot of great hard work out there. I want to say thank you to a few other companies. Publix, Walmart, Winn-Dixie, and Sam's Club all have special hours for first responders and healthcare workers, essential workers, where we can go and shop by ourselves and before opening, so we can get in, get out, and get things taken care of. So it's just really cool. Lots of companies coming together across the world and across the country to just support each other, and we just love seeing that stuff, and we just want to say thank you so much. So lastly, I'm going to give you all the statistics for the country and the state. What I normally do at the end of this is just give you this, and just so you guys know, I don't like to focus on this stuff too much, but I like to let you guys know what's going on in our county and our state. So nationwide, we have 849,092 cases, with 84,050 have recovered from COVID-19. We have 47,681 deaths, so it's roughly a 5% countrywide death rate. In Florida, we've got 28,576 cases. We have 748 deaths. It's about a 2.9% death rate. We've got 3,745 hospitalized statewide, so that's about 14%. Okay, Citrus County has 92 cases. As of about 3 o'clock this morning is when I confirmed all these numbers. We've got 9 deaths, so it's about 9.7% death rate. We have 25 hospitalizations in Citrus County, so that's about 27% of all confirmed COVID-19 cases were hospitalized in Citrus County. The age range is about 3 to 93. This stuff is always changing, okay? All right, so neighboring counties, Sumter County has 164 cases. Hernando has 83. Marion has 132. Levy has 13. Folks, remember, call 911 if it's a true emergency, okay? If it's not a true emergency, utilize telehealth, call your healthcare providers. Most places are doing virtual appointments, telehealth appointments, which are just fantastic things. I'm so thankful for technology and how we can do that sort of stuff now. So guys, remember, we at Nature Coast EMS, we're equipped to handle your emergency. We can take care of you. We have the PPE we need, and we're out here working hard to decrease the spread, flatten the curve of COVID-19. So I hope you guys have a great day. Take care of yourselves. Be kind to yourselves. Be kind to each other. We got this. We're sticking through this, and just be well.